Hi, my name is Paul Winchester. I'm clinical professor of neonatology at Indiana University School of Medicine, and I'm an attending neonatologist here at St. Francis Hospital. So what first interested me in medicine, I suppose, didn't come to me until I was past college and into graduate school. And I realized that I wanted to know how the body works from inside to out. I was already in a graduate program in experimental psychology, and I thought that learning how people think and figure out how to remember things was the most important thing. And then I realized that I needed to know everything, the biology of the human being. And the only place that would teach me all of that was medical school. My brother and I are the first in our family to be in medicine for generations, so it wasn't something that we inherited from anyone in our family. I think when I started medical school, because I had no preconceived notions about what kind of doctor I would be, I began to embrace each rotation as it came. I started with adult medicine and adults, and then I got to obstetrics, and then I got to pediatrics, and then I got to neonatology. In the course of all of that, I fell in love with neonatology. It's a combination of the best of all subjects, patients to care for, and there was a lot of high tech involved. So we were kind of surgical in many of the ways we treated those babies, but at the same time we got to interact with families who for the most part loved their child and wanted their baby to be well. Neonatology is interesting to me specifically because it deals with my favorite group of patients, which are babies. There was an unusual aspect to my life and my birth that I really didn't know about until well into my career. But it's symbolic in some ways because I do research on the birthing process and the outcome of pregnancy. It's my greatest passion. It turns out my mother was the first in North Dakota to receive as anesthesia for birth hypnosis, which my father, being a professor of science there, thought would be an interesting experiment to see if she could go through her whole labor and delivery without pain medicines. And so she was hypnotized during the course of the birth. And believe it or not, in my later years I had a regression to see if I could remember my birth. And the things that I remembered exactly were correct. And my birth was surrounded by observers, people watching to see how it went, and also I noticed that my mother was sort of out of it. So I suppose my own birth was an experiment in neonatology, and it's kind of gotten worse ever since. I think what happens to all of us in motivating us to become who we are is really more a discovery of our passion. We couldn't have given a name to it through most of our life. If you'd asked me when I was 11 what I wanted to be an artist. But as I went through my life, I realized my passion is taking care of mothers and babies. I do think I've contributed to the field of neonatology, which when I began my residency and fellowship was rather new. In fact, the first neonatologists in the country were my instructors, and we both took the boards at the same time. So there was a lot to learn back then. But one of the things that I invented, developed, and used for the first time was a high-frequency ventilator. After a process of discovery that began in my fellowship and then extended to devices that we could use on children and saved some babies with for the first time, eventually seeing my designs incorporated into commercial devices that are now in use. So that was an exciting contribution. I've also contributed to extending the use of prenatal steroids to babies, mothers who are less than 28 weeks gestation, to babies that have bronchopulmonary dysplasia. And I was instrumental in bringing the first prematurity prevention program to Colorado. In fact, being the first neonatologist to practice outside of Denver. The way that you give back to others starts every day with being kind to the first person you meet and being kinder still to the next person you meet. And beyond that, take the gifts that you are given, and we're all given different gifts, and apply them to their maximum to helping others. As you and I have talked, if you have the gift of music and art and science, that's where my nexus of effort is to try to help in those ways. My plans for the future are to continue being a neonatologist. I'm practicing with a greater joy and fulfillment than ever. And there's nothing that gives me greater pleasure than seeing the next patient and family and finding out who they are and how valuable their child is to them. But the other part of that is the gift of being able to do research and discover perhaps how we can make all pregnancies healthier over time. And there's a very, very extensive research history for me that ultimately is aimed at preventing the reasons that babies need my care. So if I were ultimately successful, I could put myself out of a job. Think about it, would the human race be better off if I weren't needed? Yes, and so that's the ultimate achievement. Outside of work, I suppose my most notable endeavors are still have a lot to do with work. I do love everything, from history to archaeology to art. I've shown Grand Champion sheep and sheared Grand Champion sheep. But I suppose I'm most proud of the things that I do with my wife right now, with her rescuing and fostering baby kittens and puppies that need a home. And so my home has become foster central, and every night we have to cuddle a new kitten or a new puppy, and then we get to see the impact of my wife's love towards those little helpless children, if you want to call them that, pets. They get adopted and have wonderful homes. So you would probably not visit my home without getting barked at or mewed at, but you'll ultimately be pretty happy. It's a cat cafe with no fee. The experience I've had that has taught me the most is a hard question to answer, because there are so many. And I don't think any one of us could pick one thing unless we lived through 9/11. But for me, there are just a number of moments of a time when I've been transitioned in a way that made a huge difference. I told you before that I sang in an opera when I was 11 years old. And ironically, that was a moment in time when the 11-year-old boy that doesn't know if he's worth anything in the human race does something big that the whole community becomes aware of. But as I moved forward in time, I got to go to a wonderful school at Stanford, and I got to work at wonderful places. I actually worked for American Airlines for 2 years, and I got to go to a wonderful graduate school. And over the time and getting into medical school, and each one of those steps, I suppose, has taught me that there is more that I can do, if that's the right way to say it. And even in entering medicine, you asked what contributions I've made. I think most of us begin medical school hoping we don't flunk out, let alone contribute to the field. And you're studying from textbooks that you think I'll never be a part of that. But now I'm writing textbooks, and I'm part of the research and the new knowledge that is in those textbooks. And I guess the lesson of all of that is that you can always do more, and all you really have to do is imagine doing more with the same talents you have. So it's not a matter of achievement so much as it is taking yourself as far as you can go towards helping others. So this is another difficult question. What historic events have I participated in or witnessed that I could talk about? And I guess the short answer, I wasn't in one of the Twin Towers when it fell, and I wasn't a witness to the event. I wasn't a witness to the Vietnam War, which many of my colleagues went to, and so to the extent that those are historic events that are memorable. For me, the memorable historic events are the small things. When my ventilator saved a baby's life, it just floored me that I could actually save a life that otherwise wasn't savable with a device that we couldn't have imagined was possible. And in fact, I remember when we first started doing that work with a high-frequency ventilator system, we were told by our instructors that this was a hopeless venture. And as we have gone forward, perhaps more boldly, and in believing that we can always find a better way than the way we're doing it, and I like to look at the nursery itself of babies that we're taking care of, and remind everyone that the nursery is full of babies that we don't know enough about, because if we did, they wouldn't be here. And so the ultimate triumph of a textbook of neonatology is that it's empty. It doesn't need to be learned because we found a way to make it not happen. And I suppose that's the miracle awareness on my part that we just need to keep working at it, and it's gotten so much better. We're saving babies that weren't savable, and it's a remarkable thing. But ultimately, we want to not have premature babies. If I were to add anything to the questions you've asked, it would be when we see people being interviewed as representatives of a specialty or a field, and we tend to be kind of hero worshipers anyway. You have to remember that, and certainly in medicine, in the kind of medicine I do, we're all heroes. Every one of the people involved in the process of caring for a child is a part of this miraculous thing. The sign up there says miracles will happen. But it happens only with a group of people who all with their own passions and their own skill sets have come together to work to save a baby. And how good can it be? That's the best thing of all.